Did you know that breast cancer is one of the most common cancers among women worldwide? It's a startling fact, isn't it? And yet, it's something we can't afford to ignore. Breast cancer, a malignant tumor that starts in the cells of the breast, is a global health concern affecting millions every year. It doesn't discriminate, impacting women of all ages and backgrounds. But here's the silver lining. With increasing awareness and advancements in medical science, we're better equipped than ever to fight back. Early detection can significantly improve the prognosis, turning a once feared diagnosis into a manageable condition. This is why understanding breast cancer is crucial. It's not just about knowing the statistics or the biological aspects. It's about realizing the power we hold in our hands, the power to learn, to detect, and to fight, because every woman deserves the chance to win her battle. Understanding this disease is the first step to effectively combat it. What causes breast cancer? It's a question that has puzzled researchers for years. We know that breast cancer, like all cancers, begins with changes or mutations in a cell's DNA. Certain inherited DNA changes, known as BRCA1 and BRCA2 genetic mutations, significantly heighten the risk of breast and ovarian cancer. But it's not just about genetics. Lifestyle factors play a significant role too. Regular alcohol consumption, lack of physical activity, unhealthy diet, obesity, and certain hormonal therapies can all increase your risk. Environmental exposures also come into play. Research suggests that prolonged exposure to certain chemicals and radiation may contribute to the development of breast cancer. However, it's important to note that the exact cause is often unknown. Many people with breast cancer have no known risk factors apart from simply being women. While we can't pinpoint a single cause, we can identify several risk factors that increase a person's likelihood of developing the disease. Early detection can save lives, but what symptoms should we be on the lookout for? Let's delve into the common telltale signs of breast cancer. First and foremost, the presence of a lump or mass in the breast is often the most apparent symptom. It usually feels different from the rest of the breast tissue and might be hard, painless, or tender. Next, changes in the size or shape of the breast can be a sign. This could mean anything from a noticeable flattening or indentation to a change in the symmetry of your breast. Skin changes are another symptom to watch for. This could be anything from redness and pitting, reminiscent of an orange peel, to the skin becoming thick or dimpled. Lastly, nipple discharge, other than breast milk, especially if it's bloody, can be a warning sign. However, remember, not all people with breast cancer show symptoms, which is why regular checkups are so important. Knowing these symptoms is crucial for early detection and treatment. Breast cancer is not a one-size-fits-all disease. There are several types to be aware of. Ductal carcinoma in situ, or DCIS, is a non-invasive cancer where abnormal cells have been found in the lining of the breast milk duct. The in situ term means the cells haven't spread beyond the duct into any surrounding breast tissue. Next, we have invasive ductal carcinoma, IDC for short. This is the most common type of breast cancer, comprising about 80% of all breast cancer diagnoses. In IDC, the cancer cells break out from inside the milk ducts and invade nearby breast tissues. From there, they can metastasize or spread to other parts of the body via the bloodstream and lymphatic system. Lastly, there's inflammatory breast cancer, a rare but very aggressive type of breast cancer. This type causes the breast to appear red and swollen, almost like an infection. By understanding the different types of breast cancer, we can better understand the disease and how it affects individuals. How do doctors diagnose breast cancer? Let's delve into that process. When it comes to diagnosing breast cancer, there are several tools in the medical arsenal. Each of these plays a unique role in the detection and diagnosis of this disease. First up, we have mammograms. These are essentially X-ray images of the breast. They are an invaluable tool in the early detection of breast cancer, often identifying the disease before any physical symptoms appear. Regular mammograms are recommended for women over the age of 40, as the risk of breast cancer increases with age. Next, we have ultrasounds. This is a non-invasive procedure that uses sound waves to create images of the inside of the body. In the context of breast cancer, an ultrasound can help distinguish between a solid mass, which may be cancer, and a fluid-filled cyst, which is usually benign. Then there are magnetic resonance imaging scans, or MRIs. These use a powerful magnetic field and radio waves to produce detailed images of the inside of the body. An MRI can provide a more comprehensive picture of the breast tissue, helping doctors to locate any abnormalities or changes that may suggest the presence of cancer. Last but by no means least is the biopsy. This is where a small sample of breast tissue is removed and examined under a microscope. A biopsy is the only definitive way to confirm a diagnosis of breast cancer. There are several types of biopsies, including fine needle aspiration, core needle, and surgical biopsies. The type used often depends on the size and location of the suspected tumor. All these methods work together to provide doctors with a clear and accurate diagnosis. They allow for the early detection of breast cancer, which is crucial in increasing the chances of successful treatment. Remember, while these diagnostic tools are highly effective, they are not infallible. Regular self-examinations and awareness of changes in your body are also important components of early detection. These diagnostic tools are vital in identifying breast cancer early and accurately. Once diagnosed, what are the treatment options for breast cancer? The treatment of breast cancer is not one size fits all. It's a tailored approach, individualized based on the type and stage of cancer, as well as the patient's overall health. Let's delve into the various treatment options that are available. First, we have surgery. This is often the first line of attack against breast cancer. The main types of surgery are lumpectomy, where only the tumor and some surrounding tissue are removed, and mastectomy, which involves removing the entire breast. In some cases, a double mastectomy may be performed, where both breasts are removed. Next, we have radiation therapy. This treatment uses high-energy waves to kill cancer cells. It is often used after surgery to kill any remaining cancer cells in and around the original tumor. Then there's chemotherapy. This systemic treatment uses powerful drugs to kill cancer cells throughout the body. It can be used before surgery to shrink tumors or after to kill any remaining cells. Chemotherapy is often used when there's a high risk of recurrence or spread to other parts of the body. Hormone therapy is another option, particularly for cancers that are hormone receptor positive. These treatments block hormones that fuel cancer growth, slowing or stopping the disease. Lastly, we have targeted therapies. These treatments target specific characteristics of cancer cells, such as a protein that allows the cancer cells to grow in a rapid or abnormal way. In many cases, a combination of these treatments is used. For example, a patient might have surgery followed by chemotherapy to ensure any remaining cancer cells are destroyed. It's important to note that the selection of treatment depends on many factors, such as the patient's age, overall health, and preferences, in addition to the specifics of the cancer itself. Ultimately, the goal of any treatment plan is to eliminate the cancer, reduce the chance of recurrence, and maintain the quality of life. With the right treatment plan, many people with breast cancer can lead long, healthy lives. So, what have we learned about breast cancer? Well, we've uncovered that breast cancer is a malignant tumor that starts in the cells of the breast, and it's a disease that can affect both men and women. We've delved into the causes, understanding that while there's no single cause, factors like age, genetics, and lifestyle choices can increase the risk. We've highlighted the importance of recognizing symptoms such as changes in breast shape or size, skin dimpling, and nipple discharge. We've explored the various types of breast cancer, each with its unique characteristics and prognosis. We've also learned about the diagnosis process involving mammograms, ultrasounds, and biopsies. And we've discussed the range of treatment options, from surgery to radiation, chemotherapy, and targeted therapies. Lastly, we've touched on home remedies, which should always be complemented by professional medical advice. Armed with this knowledge, we can all play a part in the fight against breast cancer.